Hi guys, welcome to Gendivero Wellness. I thank those who have subscribed to my YouTube channel. I really appreciate you for your support. Those who have not subscribed, kindly subscribe and press notification bell so that you can be notified when I post the new video. So depression. The major depression is characterized with all the symptoms that we have talked about. The symptoms like feeling worthless, feeling hopelessness, having digestion problem including diarrhea, having sexual problems, having interaction problems. It touches all walks of life from physical, cognitive or thinking, socialization, and also about your connection with the higher power. The second one is persistent depressive disorder, a type of depression that is almost similar to the first one that I've mentioned, but this one tends to last longer. It can last 1 to 2 years with almost the similar signs and symptoms that we discussed earlier. The third type is bipolar. Bipolar, I'll be talking about it separately, but now I'll just mention it. It is also part of the depression where you have manic depressive disorder, bipolar disorder, and also mania bipolar. Four is seasonal affective disorder, or we call it in short SAD. Sometimes you may see people during winter or when it is very cold, people having very low moods. Like we say, you may see our visitors, tourists, leaving their home country to come and enjoy sunlight in various countries. But we don't know to other people, where do you go when it is very cold? There are people who are affected by this season. When it is very, very cold, they go to very low mood, and it is still a type of depression that affects people. It is called seasonal affective disorder, or SAD. 5 is psychotic depression. That is characterized with hallucinations or hearing voices, paranoia, or becoming very negative. It is also associated with the delusions, which is thinking or feeling of things that are really not there. On my line is peripartum or postpartum disorder, and this is a disorder that is experienced by most women or ladies, especially after giving birth, 2 weeks or thereafter, where they experienced this type of depression, and they are even not able to take care of their babies. Even they are not aware of themselves. Somebody has to supervise them or take care of them 24 hours. And is premenstrual dysphoric disorder, and this type of depression, it is a kind of depression that are experienced by ladies, either teenagers, young ladies, or mature ladies. This is immediately before or during menstruation, where they feel very low, where they experience digestion problem, and including nausea, and even it can affect one way of either performing the duties or going along the daily activities. 8 is situation depressive disorder, and this is a type of depression that affect people in the way that they cope with events. This is, for example, when people experience loss of jobs or loss of a loved one, or divorce, separation, or if somebody has failed the exam, that kind of failure they are able to cope with the situation, and it can result to that situation depressive disorder. The other one is typical depression, where one is oversensitive, overall very sensitive to criticism. Also feel increased appetite or increased desire to sleep. Also can experience heaviness under the arms or under the legs. So our last type of depression is resistant treatment depression. This is a type of depression that is either affected or it is resistant to the treatment that is used to treat depression, or maybe it is caused by other conditions that one may be having, and it can only be treated by electroconvulsive therapy. Guys, let us look at the causes of depression so that when we know the causes, we can easily prevent ourselves or protect ourselves from getting into depression. Some of the causes is family history of depression. That means you may have one member of the family having depression. So if this person had depression, there is a possibility that you can have or you can give birth to a child having the same thing, or they can inherit the same type of depression. The next cause of depression can be health issues. This is especially in regard to if somebody is suffering from terminal illness or struggling with the disease for a long time, they can easily develop or have depression because of the long-term struggle with the disease. Medicine, drugs, and alcohol. There are some drugs, whether prescribed or illegal, if used in negative way, can cause depression. Misuse of alcohol can also cause depression. There are also personalities that are associated with depression, trauma or child abuse, sexual abuse of children at a young age can also result to depression. Conflicts, quarrels, and fights in the family, especially where we have family parents abusing one another, we can have children developing depression. Death, loss and grief, and especially sudden death, or where death occurs and people have not been able to handle the loss or grief that is associated with that loss, even loss of jobs. If this loss is not taken care of, it can result to depression. And they say that women are more prone to depression. Science has not explained in deeper why it is, but we hear that women are prone more to depression than men. Genetic. There are also some genetical genes that are more prone to depression. These genes can be having chemical imbalances in the brain. The brains that the brain is incapable of transmitting hormones in the brain. So when these chemicals are affected, it can cause some functionality, or can cause the brain not to function in the normal way. How do we treat depression? Because if it has come, it has not been prevented, it is here with us, we cannot stay with it. Remember, the first thing is to be diagnosed or to be done assessment so that you know whether you have it or not. So if you have it, what steps do you take? You can either choose to do whatever you feel is comfortable with you. Remember, depression is manageable. It is not permanent. It is not a clinical illness that you have to live with it forever. It is manageable. So it can be treated with antidepressant by psychiatrists. It can also be treated through psychotherapy or counseling, undergoing counseling sessions. And it can also be treated with electroconvulsive therapy, especially the type of the depression that is resistant to the drugs that psychiatrists can prescribe. Depression also can be treated by having friends that you socialize with. We hear that happy moments are good for individuals. The research says that those who laugh more are able to live or to avoid being depressed than those people who don't smile. So smiling in a day, laughing, creating a kind of humor, it is a treatment for depression or prevention. Socializing with friends is a plus to all of us so as to avoid becoming depressed. Also, connecting with the people or communicating with the others, even if you are not going to meet physically. Today we have opportunities of having whole networks, either social media, in emails, in messages, in making phone calls. There is a way you can have connected to other people. Remember also, you can have a kind of exercise, physical exercise that you can do so that you can feel relieved. You can also visit your friends to stay connected, as I mentioned earlier. And you can do things like yoga. You can do you can also connect with your higher power, praying, reading Quran, reading the Bible, reading storybooks, and you can also do relaxation techniques to help you get out of this. But about that relaxation technique, I will show when I will be talking about anxiety. So thank you guys for staying tuned. Those who have not subscribed, kindly subscribe